Lagos State is a big state. The population is quite a bit. The private sector provides about 60% of service delivery to the citizenry. With the PPFP project, they have been able to provide family planning services in the private sector, which is very helpful for the state because in terms of access, the private sector was not where we wanted it to be.
Though we've been going to private sector to integrate through, I think, another program, but it has not been as effective. We've not been able to cover a lot of ground. But with PPFP, we were able to have an additional mileage in the area of private sector coverage. The private sector we have in the state are well over 4,000 registered ones at the moment. And we believe that if all of them are able to get capacity to be able to provide this type of services, we'll go a long way in achieving our contraceptive prevalence rates.
Basically, for us in the public sector, family planning services are free because as a government we have committed to ensuring that these services, which we feel are life-saving services, are rendered free. In the private sector, they are not necessarily free, but we've gotten a support from the private sector to ensure that minimal amounts is charged. So for those who would prefer going to the private sector to ensure that service, they can access service, they also get that service. But in terms of quality, I like to say that we have standardized trainings. So across board, we expect that whatever service you get will be optimal service because everybody has been trained based on standards across both sectors, yes.
The private sector, we collect tokens. But the similarity is that all what we are giving, they are all the same. And that they are methods that we are all trained to provide. So they also in the public sector were trained to provide those methods. Modern contraceptive methods, we are all trained for them.
So with PPFP coming on board, they have been able to increase access to family planning services in the private sector. Now, access includes things like building capacity of the healthcare workers, establishing linkages to where they will get the family planning commodities, improving quality service within the private sector, and of course ensuring that whatever job is done is always documented, because if it's not documented, then it hasn't been done. So they have been able to increase access and build technical competence in the private sector.
Our partners, our stakeholders who are the private health sector, you know, one of their major issue or challenge that they've been complaining about is what is it that the government has to give them back. And for PPFP to introduce this a little makeover for the hospital, I think is a good encouragement. You
know, when you are engaged by PPFP, the first thing they want to do is to get a guarantee that you're ready to go the journey with them. And they tell you what the basic standards will be. And for some of them, they've been very happy to have their makeover sessions, which is where they help in refurbishing the facility to ensure that it looks pleasing to the clients who come. And of course, technical capacity, the way your clients, your service providers will talk to you in terms of interpersonal communications, it's really very nice. And they've been able to do that in the private sector for us, not just to say that I'm coming in here because the place looks nice, but I'm coming in because it looks nice. Quality of service is excellent. You get treated right. What PPFP has also been able to do is that they've also been able to ensure that they don't just render services within the facility, they go out to get people to come in to say that we offer these services. So we go into the community. Maybe we weren't doing it before, but we do it now. We're welcoming you to come into our facilities, and so they pull people into the service.
Unlike before, that we are not able to capture what the private sector is doing because we have limited human resource that that can be involved in monitoring these people because of their large number. But with PPFP, they've actually augmented what we are doing by ensuring that a lot of them report now on what we call DHIS platform, which is a data collecting platform for us.